Has this ever happened to you or your loved one?
I had to do an ultrasound, and so I was in the room, and they said, all right, we need you to come back next week to do a biopsy because what we do see something, and it looks suspicious for malignancy, so please, on your way out, schedule the biopsy. So of course, it's the weekend, it's Mother's Day weekend, and I'm just, trying to be positive, being like, okay, this is gonna be fine, everything's gonna be fine, it's just, a formality. And so then on Tuesday, I had my biopsy, and on Wednesday they called and said, okay, you have cancer. And it was just, you feel like you've been hit by a train. You're just like, what?
Yeah. Did you know that about 5,000 people each day, when they get diagnosed with cancer, feel like they've been hit by a train? It's disheartening. You don't know what to do. In this Care Pods, we have a special guest, Whitney Dombroski, RN at Texas Oncology, and she's going to walk through her story, which is amazing. She is a cancer survivor, and now she helps take care of patients with cancer. Stay tuned for a great episode with Whitney Dombroski. Whitney, how's your day going?
It's going well. How about you?
Not too bad.
Good.
Not too bad. Thanks for hopping on and letting us hang out with you and talk about just who you are and being a nurse and being a mom.
Yeah.
So thank you so much.
Yes.
Yeah. So if you don't mind, just tell us about yourself.
Yeah.
Tell us how you got into being a nurse and the whole story. So.
Okay. Well, it's not the shortest of stories, but I'll start kind of at the beginning.
Yeah.
So I had breast cancer 16 years ago, and at the time my kids were 2 and my son had just turned 5 months.
Golly.
So I was a teacher. I was a teacher before that. So backtrack even more. So I had my first degrees in business from University of Texas in Austin. I did that for about 2 years. Then got engaged to my husband and decided I wanted to get my master's in education that I would have the same schedule as future children. So
That's
I taught
a good idea.
special ed, PPCD, which is preschool program for children with disabilities, and then first grade and fifth grade special ed. So kind of in the mix of that is when I had my children and got diagnosed with breast cancer.
Wow.
So it was kind of a crazy situation of how I even found it. So I was pregnant with my son.
Yeah.
And I just felt like something didn't feel right.
Yeah.
And so I was 6 weeks away from delivery. So my doctor was like, let's just reevaluate after you, deliver, and we'll see if things change. And so had him, was busy with, a toddler and new baby, and so didn't really think much about it. And then a couple months later, I was like, okay, something still doesn't feel right. And I was nursing, but, just my right breast just felt different than it was supposed to. So I scheduled an appointment with a general practitioner just to kind of have a full physical, because I hadn't really had one in the past couple years, having 2 kids. I was just following up with the OB-GYN. So I went in, and she said, okay, I typically would do a breast exam, but since you're a nursing mother, I'm not going to. And I told her that's why I was there, that something didn't feel right. So she was doing her exam, and she said, okay, I do feel something. And she said, let's order a mammogram. And so we did the mammogram, but it was about 9 days later. By that time, the lump was no longer there because it was mastitis. And so she had me on an antibiotic. But she said, let's still go ahead and do the mammogram. So we did the mammogram, and this was the Friday before Mother's Day, mind you. So I'm in there, and they, any women who've had a mammogram, they know that they say, okay, we're going to do the mammogram, stay right here, and if we need to pull you back in to do an ultrasound, we will. So I was in this little room. 5 minutes later, they come back in and say, okay, now we've got to do an ultrasound. And so I was in the room, and they said, all right, we need you to come back next week to do a biopsy because what we do see something, and it looks suspicious for malignancy. So please, on your way out, schedule the biopsy. So of course, it's the weekend, it's Mother's Day weekend, and I'm just, trying to be positive, being like, okay, this is going to be fine. Everything's going to be fine. It's just, a formality. And so then on Tuesday, I had my biopsy, and on Wednesday they called and said, okay, you have cancer. And it was just, you feel like you've been hit by a train. You're just like, what?
Yeah.
Then every, horrible thought crosses your mind of when you're putting your babies to bed. Am I still going to be alive to see them go to kindergarten? Am I still going to be alive to see Cole's first birthday? Ooh. Because that, the minute of diagnosis, it's the fear of the unknown. You don't know what's to come. But my team was amazing. So that was May 14th. And then the 29th of May, I had a double mastectomy. And then right after that, met with the the oncologist. Had to go back in 2 weeks after that because they thought that it was all contained and not in the lymph nodes. But then when they did final pathology, it had moved to the lymph nodes. So I had to go back and get all the lymph nodes on that side taken out too, which luckily those were negative. It was just the one. But so I started chemotherapy. I did 6 rounds of chemo. So we had a shave the head party so that I was the one deciding when I was going to be bald, and shaved my son's hair because, he was only a baby, so he didn't care. And a neighbor just shaved his head. My dad shaved his head. My uncle. So we had a big group that, rallied around, and it was awesome. And, it was a good summer of not having to shave, because when you start chemo, you don't have to shave your legs. You don't have to, fix your hair because it's gone. And, but yeah, so did all that, did the 6 rounds, everything went great. And then you have your follow-up scans, and everything was good. And then, so I finished chemo in October, and then the following fall, they were just monitoring. I did the breast cancer, the BCRA, to see if it was genetic, and it was not. But there was one allele that looks at the link between breast and ovarian cancer, and that was the one that was inconclusive. So they were just doing, abdominal ultrasounds just to make sure that nothing else was going on. So then they thought I had ovarian cancer, and so I had a total hysterectomy almost a year after I finished that.
Whitney, you're like a superwoman.
But so luckily it was not. But yes, I said my stomach looked like a big T, because I had 2 C-sections, and they had to cut me vertically for the hysterectomy, because they said if it was, they had to do staging, and they didn't want to have to cut me twice. And so all these people who are like, oh yeah, hysterectomy. Mine was a little bit more involved. But I still went back to work teaching preschool 4 weeks later. I will say. But yeah, but since then, everything has been amazing. And,
what?
Yeah.
Wait. Wow. You're incredible.
So then, I still taught for several years. So I went back to work and taught at Beatty Early Childhood for the little 3 and 4-year-olds that are newly diagnosed with, autism, or they had Down syndrome and were needing speech therapy or things like that. So I did that for 4 years. And then when my son was going to kindergarten, I transferred schools so that my daughter, son, and I could all be at the same school. So we were all there for 3 years. And then I was just kind of looking for something new. So I decided, talked to my husband, and I said, hey, what do you think about me going back to school and being a nurse? And he was like, okay, if, this is something that you want to do, then do it. And, the kids were a little bit older so that I could study and not have to entertain them 24/7. You know this.
Oh,
You're here.
Oh gosh.
That age I couldn't have done it. But so I went back to nursing school, and with the goal to work at Texas Oncology. I am, work at the clinic that I was treated in 16 years ago.
So cool.
And it was kind of a full circle journey. And, I love what I do, and I love that I can sit on the opposite side of the chair of patients and, empathize with them and be like, I was sitting where you were, 16 years ago. And, I know the fear of the unknown, and I know that, your life's never going to be the same, but it's going to be different, and it can be better because you now have perspective that you didn't have, prior to having this. So, but yeah. So that's not a short story, but that's how I got to what I do today.
But that's amazing. Wow.
Yeah.
Wow. Like, okay, let's unpack this amazing story. That's just number one. Like, that is pretty incredible. Like, going through all of that and having, like you said, little kids, but you had an amazing support system. So like, when you sit with patients now, and like, how do you what's some things that you do to encourage them through that process when they first get diagnosed with something? Like, what are some things that you do? Yeah,
well, I don't necessarily share my story straight off the bat, because I feel like it has to be an organic and authentic moment, because everybody's journey is so different, and some people want to hear that and some people don't. And so it kind of depends on what questions they have. If they talk about that they need to get a port and they're scared with the port and that it's going to leave this horrible scar, sometimes I'll just say like, well, here's my port scar, and you can't even really see it anymore. And
they're like, what?
They're like, you had cancer? So it might be something like that. Or women especially are terrified to lose their hair. And, it's never going to grow back and all this. So those are moments that I say, hold on just a minute. And I go get my phone and I show a picture of me bald. And they're like, and your hair's back. And so it kind of,
cool.
That's
super
it eases their fear of, that they're never going to have a normal look normal again. And especially for women, it's definitely a fear with breast cancer that they don't feel like they're a woman anymore, because if they have a mastectomy and their hair is gone, they think all the traits that make them feminine are gone, and they can see that, it's not the case, and like you can kind of reinvent hope. Yourself, and tell them they can go get a real fun wig that would never look like them in the past, before, and have fun with it and things like that. But I mean, I also try to let them know that their journey is unique. And some people want to join support groups because they want that. Other people don't, because sometimes some people feel like it actually worsens the situation when you hear these horror stories of everybody else's journey and yours is not going that bad. So you might feel guilty that you're having a better experience.
That's really true.
Or it just scares you that this is what could be, and people shy away from that. But I just tell them that, we're here. This is not a chair that anybody wants to sit in. But that, our job is to make this as easy for them as possible, and just trying to get to the other side, and, one day at a time, and don't try to look too far ahead, because, I mean, not to be a negative aspect, but just, focus on yourself and give yourself grace and allow yourself to rest. And when people offer to help you, they want to help you, and give them something to do. And whether it's, some people want a friend to come sit with them in chemo. Some people don't. Some people want a meal. Some people want you to pick up their kids from school, but it's a good idea to give people something to do, whatever it would be that would help you and take something off of your plate, so that you can focus on you and getting better, and save the energy for your family and the things that matter to you during this.
Wow. So. What are some things that, when you first got diagnosed, was there anyone that like said things that were just like unintentionally rude? Or like, oh man, like it kind of hits you, like people don't realize that you shouldn't probably say?
Well, I think, forgive me, Mother, if you watch this, but like between the mammogram and the biopsy, my mom just kept going, it's fine, it's going to be fine, it's not going to be cancer, you're fine, everything will be fine, and I was like, Mom, I know that everything will be fine one way or another. I was like, but can you just recognize that I'm scared right now? And she was like, I know. She's like, I'm scared. And then she starts crying. She's like, I'm scared too. I'm just trying to be positive for you, and which I get it. But it's, I think also when people are in the thick of it and people say, oh, I have this friend and they were fine. Ooh. That's great. However, I'm not your friend right now. And, every emotion that you're feeling is valid, and it's real, and it needs to be, you have to acknowledge, and you have to feel safe to express that, especially to your family and innermost circle, that, just hear me out. And it's not that I want you to fix anything. I just need you to know how I'm feeling.
To have it's like a safe space to be able to say, hey, these emotions I'm having are really real. And I need to be able to get them out. Right. Without any judgment, without any, like, I'm sorry you're not going to like me for 5 minutes, but I've got to say this, but it's not me. It's just, my anxiety or my fear or whatever we're talking. So. And that's a really good point, because it allows that person, whoever it is, to process it and to be able to like take the information in as it comes. Wow. So going from, how was that journey from like overcoming cancer, right? And then also now going back into getting your nursing license. And then now you're sitting in front of patients and encouraging them. Like, what is that emotionally? How does that make you feel? I mean, just in general, just curious.
I mean, it makes me feel proud, honestly. I can take something that was, a not most positive part in my life and turn it into something that's amazing, and being able to pay it forward to other people who, are struggling, or, and being able to celebrate when they finish treatment, or, when they get to their 5-year mark, or they get to their 10-year mark, all of those things. It's just, going through nursing school, I feel like, number one, I wasn't, 19 or 20. So, I kind of had a different perspective going in of, this is why I'm here, and this is what I'm focusing on, and this is what I want to do, versus I don't know, maybe I'll do ER, maybe I want to do labor and delivery, maybe I want to do this. I had a very specific goal in mind of what I wanted to do. And I was very grateful that Texas Oncology had a new graduate program.
Oh, wow. Yeah.
And I think it was only the 4th class they did them. So I was originally going to work at Presby Dallas on the cardiac floor and do nights, which I'm not a night person. I'm very much a morning person. Yeah. So that was going to be a real struggle with kids and trying to figure that out. And luckily, God had better plans. I found out about this program, and so I applied and actually got the offer on the day of my graduation from nursing school, which, mind you, was May of 2020. Yeah. In the middle of the pandemic.
Oh, God.
So we had a drive-through graduation. You had to stay in your car, and you drove through, and they handed you your pin and your diploma. Literally, we had to stay in our car.
Ooh, wow.
So it was interesting. But anyway, so...
What nursing program did you go to?
Collin.
Oh, nice.
They're ADN, and they did my bachelor's at Texas Tech online.
Wow.
So.
Wow.
Yeah. So, but I started with Texas Oncology, and they do a great job of the intern program. So you have 2 weeks of classroom, 6 weeks of infusion training. Nice. Most of the nurses go and stay in infusion. Okay. I went rogue, I guess. So I decided to go clinic side, and not many people do that just because they feel like there's...
What's the difference between those two, if you don't?
So infusion is just you're in the infusion room. You're the one actually administering the chemo to patients, or IV iron fluids, whatever the patient might need for supplemental treatment. And then the clinic side is where you are actually in the clinic with the doctor. Maybe you're chaperoning procedures, or you're the face for the doctor, if you will. So you're the one that is...
So Dr. Stone works for you.
Dr. Stone works for me. But when the patients call, I'm the one talking to them. After Dr. Stone goes in to see the patients, then I go in after him kind of as a follow-up, just to, sometimes it's just purely social. Be like, hey, how's the family? How are the kids? How was your trip that you went on last month? Whatever. Yeah. But it's also just to follow up. A lot of our women patients ask me things that they don't ask him, because they're like, okay, I didn't really want to ask Dr. Stone this, but, and so it's just a kind of he calls me the closer, I go in there and it's like, okay, I forgot to ask for this refill of this prescription, so it's all of those things that kind of tying up the visit, right?
That's cool.
To be, and I like the personal face-to-face with all of our patients, because I then get to know them, not just as a patient, but as a person. Wow. And so when they call, it's not...
You get their whole journey.
Right. Kinda. And so it's, it's talking about everything, every bit of their life. And some people, he has to knock on the door and be like, I need you for the next week, because some of them do. They want to talk for 20 minutes, and, we have to kick them out. So.
Wow. That's cool. So really you're looking at the different type of nurse. It's like an infusion. Right. You don't get to spend too much time with them. It's kind of like...
I mean, they do, because if somebody's in there, some of these treatments are all day. And so they might be in the infusion room all day. Okay. But yeah, like as soon as treatment is done, then their journey with the infusion nurses kind of ends.
Gotcha.
So they're in there for treatment. But as far as the clinic side, most of these patients, he's got patients that have been with him for 25 years since he started, and so it's one of those long-term relationships even if you're good in 5 years, you're still going to be coming annually, just to make sure. And if anything pops up in the meantime, you call, and you kind of have earned the right to be a hypochondriac in a sense, because if you kind of discovered that something wasn't right, and that was how you found your cancer diagnosis, then, if something comes up and you're like, hey, my stomach's really been hurting and I don't have any way to explain it, he's really great about like, okay, let's do an ultrasound. Let's do a CT, to make sure that nothing is going on. And
that's cool.
Yeah, so that's
cool. I want to ask you a couple other questions. So when someone is newly diagnosed with cancer, right? Like, if you don't mind, just kind of walk. So, like, if someone just got diagnosed and they were in your exact shoes, can you walk them through kind of like the stages of what they go through, just so that they kind of understand, like, okay, this is what to kind of expect.
As far as what, the medical side or the emotional side, or both?
Both.
Okay.
That would be awesome, because I think it's hard to... Cancer's a scary word. Right. And I think it's hard for people to understand what the pathways will be, because nobody really knows the pathways. But the fact that someone like yourself has gone through it, at least medically understanding these are the steps, and then emotionally, what are the things they're going to expect, and how do they prepare themselves, if you don't mind.
So typically, you don't come to see an oncologist until you have a cancer diagnosis, for the most part. So you would have already had imaging, perhaps, that showed a mass or something, and then you'd have a biopsy. And then once you have that pathology, then that's how you'd be referred to the oncologist. And so most of our patients already have a diagnosis, but that's all they know, is I've got this diagnosis. I know I have cancer. Some of them come and don't really even know what kind of cancer they have. So that's the first step, is when you're meeting with Dr. Stone. He goes over the pathology. He says exactly what type it is. After that, it could be that you need to now go to a surgeon and have the mass removed. It could be that you're going and having a PET scan to get more detailed imaging and to see where else in your body this could be. Because both of those things could, affect what the treatment might be. So if you're early stage cancer or even later stage cancer, the options might be that you're going to do radiation after that. So after you do surgery and you've healed from that, you might just do radiation. And that might be your treatment, right? And then you're going to do imaging a couple months later, see if everything worked. Other patients, they're going to start chemotherapy without surgery. They're just going to do chemotherapy right away. So some tumors and some types of cancer, they do the chemo first, and then you might do, 3, 5, 6, whatever cycles of chemo, and then do imaging, and then you might do surgery after that. Some patients do chemo and radiation together. And
is there a reason why?
It just depends on the type. And non-small cell lung cancer, for example, you might have a resection of one of the lobes of your lung, and then you would do chemo radiation together for 5 or 6 weeks, where you'd have chemo once a week, but radiation 5 days of the week. And then after that 6 weeks, you take a break for about a month, and then you do imaging to see what the response was. Sometimes you have to, if there's still something there, then you have to figure out, okay, are we going to now switch chemo and do second line? Some patients after that are in complete remission, and you just continue to follow up and see every couple months to see how everything's going. But so it depends on the type of cancer, but those are kind of the different pathways, that you can go down as far as what's going to happen after that diagnosis. But yes, it is definitely an emotional roller coaster once you get diagnosed, because each step creates more anxiety. So it's, you have the anxiety when you have the image, the first image, then you have, heightened anxiety when they say you need a biopsy. And then it's like, okay,
it like builds.
Now, it's just this little stair steps of where you're just overwhelmed. What ifs, yes. And you become so overwhelmed. But I will say that once, for me, and I think a lot of our patients, once they met with the oncologist, and it's like, okay, here's what you have. Here is what we can do about it. And once you have the plan, it kind of puts that anxiety back in the box to go, okay, like now there is a way forward from this. It's not, the end of the world because I have cancer, but, other people have now, this is proven treatments that have worked for a lot of people, and now they're standard of care. So we can go forward, and if this doesn't work, there's still other options to do. And there's people that have metastatic, stage 4 cancer that live for years and years because the treatment's keeping it at least at bay. It might not be going away, but it's keeping it stable and extending their life and extending their quality of life so that they, can enjoy we know what time they have left. None of us are promised tomorrow, but with people with, metastatic cancer, it looks a little different. So,
So you're looking at, and that's a really good point, because you mentioned that you're going from the what if, and then another what if, and then another what if. So during those what if moments, those periods until you meet the oncologist, what are some things that you did maybe like to kind of ease your anxiety or support, or how does that?
I would say until I met with the oncologist, it was still like, oh no, because I said am I going to see my kids go to kindergarten? Am I going to see the first birthday of my baby? And so it's But once you have it in place, you put your support system in place, and people are offering to help, come keep my kids, so that I could take a nap, things so I didn't have to feel guilty about not being up and present with them 24/7.
Yeah.
And so that was such a gift to just be like, okay, these 5 hours, you cannot come out of your room. You can watch TV, you can read a book, you can take a nap, but just stay in your room. We've got the kids. And they would take them to go do something, or, just play with them, but you have to have a support system.
Yeah.
And there are a lot of our patients that don't.
Yeah.
And that makes it a whole different, set of trials and tribulations for these patients that truly don't have anybody to bring them to appointments if they feel like they can't drive, or, eat nutritious food because they don't have the energy to cook, and so then the more you're not eating, the more fatigued and weaker you become. And so it's trying to connect them with the resources that they need to make sure that they're getting the full benefit of the chemo and the full benefit of what we as Texas Oncology can offer them. So
that's a good point. So during the you mentioned having radiation and chemo, and that's a lot on your body. What are things just general foods? You mentioned nutritious foods, but what are some things that you guys recommend families and patients to do?
Eat protein. Eat even if you don't feel like it. If there's a lot of patients that, my dad for one, who does not, if he's not hungry, he won't eat. And you have to kind of drill this into patients. It doesn't matter if you're hungry. You have to eat.
Your body
you have to drink, because if you don't, all of this chemo is for nothing, right? Because if you get too weak, we can't treat you.
True. Yeah.
And if you're not going to do your part of trying to stay as healthy as you can on the parts that you can control, then it's going to affect everything.
Yeah.
So, but we have a great social worker who, anybody who voices any concern, we do depression screenings for patients, and they, fill out any concerns that they have. And so if there's something that we can't necessarily address in the office, then we'll send her a message, and she contacts the patient to see what resources we have available that maybe aren't in the clinic, but that she can connect people with.
Well, that's cool.
It's like Uber and Lyft gift cards, because you're not driving and you need a ride there. It's, the DART ride share. There's,
that's a great program.
Patients who qualify for Meals on Wheels, therapists. That's
cool.
A whole gamut of things that patients might not think about. But when the social worker says, tell me a little bit about what's going on, and then she can kind of dig deeper and see what we can do, whether it's paying their utility bill for the foundation that we raise money for.
Wow.
Yeah. So, but yeah.
That's pretty cool. That's pretty cool. Yeah. How's it going on that? Good? Sweet. You're doing good.
She keeps answering all my questions.
It's like, I got one. Oh no. Yeah.
Are there any patients that don't want to tell their families?
Yes.
And how do you go about
we don't want that if they don't give us permission, we can't tell them.
Yeah.
It's their journey, it's their choice, and
to respect it.
You have to respect it. And if somebody calls, and we've had this happen, where someone in the family will call and they know that their family member has come to our office and they want to know an update, and if we don't have a HIPAA signed form, it's like, I'm very sorry, but I can't talk to you about this. Yeah. And if your family member wants us to talk to you, then they need to sign a form saying that we can release information to you. But yes, there's been some contentious family battles and family drama that they want to put us in the middle of, and it's like, this is not we're
real life family feud, right there.
But it's like our loyalty is to our patient, and it's their choice on what they want to tell you. So, but yeah, it can be. It can be
messy.
It's a very emotional time anyway, and if patients don't want to include family members, then they feel shut out. But again, it's
their choice.
They have to decide what is best for them in the moment. So, but yeah.
Wow. What does your day-to-day look like? So when you're at the office, the clinic setting, what does your normal routine look like? Just curious.
Yeah. So I usually get there probably 45 minutes before our first patient, so that Dr. Stone and I can kind of go over the list of patients that we have for the day. He gets there way earlier than I do. And he's like planning everything that he's going to do. So that by the time I get there, he's like, okay, this patient, we need the most updated path on this. This one, we're going to start this treatment. Can you print off the education sheets? This one, I added 4 labs to what we already had. And, this one, we're going to need a PET scan and refer them to this doctor, this doctor, this doctor. So I kind of, make notes on the schedule of what's happening. Any new patient I go in there and, give them my card and walk them down to the lab and kind of show them the lay of the land. But every patient that goes to treatment, I walk them to the infusion room and, help them sign in. But yeah, I mean, so some days are calm, because it just kind of, everything flows how it's supposed to. And then, other days you're having to call 911 because the patient's, not doing well, and, kind of anything in between that. But, it's, for some reason, Fridays at 4:00, everybody wants to call and say, "Oh, I need a refill on this," or I need,
it's everywhere.
I'm sure y'all know that. It's like, okay, you haven't called all morning or all week, and now it's like everybody needs something.
Yeah. Or Sunday night.
Yeah.
Wait, we can't get that for you.
No, but
wow.
But I mean, every day's in a way kind of the same, but every day's very different, just depending on what patients are coming in, and there might be some that don't call that often, but when they come to their appointment, they have all these things that have been going on, and they
you have to catch up.
And you have to catch up and try to see, meet them where they are and figure out what they need, as far as that day or the next week or before they see us again, and try to just be their sounding board and get what they need. So
on average, like a daily, how many patients do you usually see, like on average, or just depends.
20, 22.
Okay,
yeah. So.
And then usually, like when they're scheduling, is it normally like, you have your PCP and you have, how many times do you frequently see those patients in a year?
In a year, it depends. So if they're on treatment, we might see some of them weekly, depending on if they're getting treatment every week. A lot of cycles are every 3 weeks.
And
so we might see them every 3 weeks. Some get maintenance that's once a month, and so we might see those patients once a month. But once you're finished with treatment, then it's kind of, you start for the 3 months out, 3 months for the first year. Then you might do imaging for that first year, and then after the first year, you stretch it to 4 months, and then to 6 months. So you just kind of keep stretching it the further out from their diagnosis and remission that they get. So but that part is a little bit stressful for patients, because you're used to coming
weekly,
on whether it's every week or every 3 weeks, on a very regular basis for that check-in. And then once it's like, you're good.
Wow.
And now I don't get to, I have to wait 3 months till I know if I'm still good.
Oh, that's another wave.
Right.
Yeah, emotional
And it's
wave.
almost like, I personally kind of had if you call it post-treatment depression, because it was, all of your energy is focused on, I'm going to beat this, and I have this plan, and I've got 6 rounds of chemo, and so in 18 weeks I'm going to be done with this, and and it's like, okay, like, you're done, and everything's probably good, and then they're like, we'll see you in 3 months and do a scan, and you're like, it's kind of like, now what? I mean, like, now, because you're like, now I can get back to my life, but you're like, but my life doesn't look the same as it did before, and so it's kind of just trying to find what your new normal is, and to embrace it, and not necessarily mourn what was, because a lot of people do, and I mean, that's totally normal to mourn the life that you had before, but it's also, in a weird way, a blessing, because you look at things differently. And when the kids were starting kindergarten with my daughter, so many of my friends were just bawling their eyes out because it was their first child to go to school, and oh my gosh, I can't believe they're in kindergarten. And I was just standing there smiling, and they were like, why are you smiling? I was like, y'all, I got to see my kid go to kindergarten. It was like, and they're like, what do you, so did, and I'm like, no, you don't understand. Like, there was a time, 3 years ago that I didn't know if I'd be here.
Wow.
And so it was, everything with like my daughter going to college. Like, it's just.
Wait, that's the same daughter?
Yeah.
Oh,
but
my
so
gosh.
it's like each milestone, when some people are mourning that their child's not this, I was like, I felt like I was celebrating the fact that, yes, beautiful. Like we've made it to this point now, and, we get to keep going forward instead of, looking back at what. And of course there were
really good
things that, during all of that I'm like, oh, I should have done this. But I'm like, you know what? No. Like, my kids don't remember. They don't remember me being bald. They don't remember any of it. Like, they remember it through pictures, and that's it. So I was like, you know what? It did not impact them in their development or our relationship, so.
Yeah.
But I do think mothers especially have mother's guilt no matter what, especially when you're going through something that you are supposed to take time for you. And just like the airplanes, you got to put your mask on first before you can help anybody else. And
that's true.
That's a big thing when you're going through treatment, is you have to take care of you. Then don't worry about everybody and everything. I mean, yes, you're not going to just neglect your family or your children, but like you have to give yourself the time to heal. So,
wow. Did you? You probably have. I'm just curious, but just are there things that for that self-care? What are some things that you did, or some things that you have patients do, like just in general? Maybe like journaling, or like.
You'd think I would have, but I didn't. No? I know. I was like, I did it. I mean, but like, I don't know. Reading my Bible, doing devotionals helps me personally. I loved taking bubble baths. Just because it was like everybody, I'd put candles and just everybody leave me alone for 30 minutes, But I also think it's, planning girls' trips with, I have a great group of high school girlfriends that we get together once a year, and college girls that we get together once a year.
Nice.
Family trips and date nights with my husband. It's kind of, I feel like I have all these different pockets that I feel like each cup needs me to fill it up. It's kind of
intentionally making sure you're doing that.
Right, and that no person is neglected, and it fills my cup too.
Yeah.
And I'm definitely somebody that I don't like to sit at home and not be doing something. I like people, and I want to be around people all the time. So
That's cool.
That energizes me to plan things with friends and family, and
that's really good.
Do all that.
That's really good. And crawfish bro.
Crawfish bro. Yes.
That's awesome. But what are some other things you want to talk about, like just in general, that you feel like be really helpful for patients and families in general?
One thing that, since I've been working in oncology, I definitely, most people say, oh my gosh, I don't know how you do that every day. Because when you think of cancer and you think of oncology, you think, of death, and you think of not good outcomes. Yeah. But I will say that working in this job has shown me that there is so much more success than not.
Yeah, 100%.
And that, even though the patient is diagnosed, and even if they have a recurrence, and there's almost always something else that we can try. Yeah. And so whether it's that you've done 4 lines of in clinic treatment and now you're not responding, there's great clinical trials that people are doing now. Yes, unfortunately, death is part of our job too, and we have a lot of patients. I mean, I wouldn't say a lot, but we do have patients that whether they decide, what, I'm done and I've had enough, and they want to go on hospice and enjoy the rest of their time, and which, that is wonderful that they come to that decision, and that their family's at peace with that, and that they're at peace with that, because they fought the good fight, and they're they're tired, and they want to just not come to the doctor's office anymore, and that's okay. But yeah, I mean, the families that come with the patients are amazing too, and it's nice when Dr. Stone, the patient, and the family are all on the same page for whatever it is. 100%. Whether it's like, we're going to try this one last hurrah and see what happens, or we're not. But it does definitely help when patients have been with Dr. Stone for a while, or not, but that they trust him, and they're like, what would you do if this was your family member? But yeah, I mean, he's a good guy. You know this.
He's a great guy.
And he's going to tell it to you straight though too. He's not going to feed you false hope when he knows that's not the case. That's not the case. And I think that patients appreciate his candor and his honesty. So
that's good. That's a very, very good point, because I feel like a lot of people forget, like, there are a lot of success stories. Right. And a lot of graduations.
Yes, there's a lot of ringing that bell in the infusion room, and a lot of gong at the radiation, and every time you hear it, every time I hear it, I get goosebumps, because you're like, yes,
it's so great. Like, and I feel like I feel like people don't talk about that
enough.
No, enough. Like we see it all the time, even on the home health side. Like we see a lot of great stories, and it's like, I think when they think of cancer, there's a word in there. It's can. Right.
Like our shirt, our sweatshirts, it says fight cancer, but it's the I and the can. Yes. So it's I can fight cancer, and that's what we're about. We're about the fight.
Yeah. So. And I think I appreciate you saying that, because a lot of times patients and families don't realize that there's a lot of good on that side. Right. And like Dr. Stone was saying recently, he was like, we help extend life. Right. And to see those great things, see those milestones. Right.
And some really patients that know that they are never going to be cured from this, but they have a child getting married in 6 months, and they're like, I just got to get to the wedding. Oh, yeah. And to be able to be a part of of that and just getting them there.
It's pretty cool.
Or getting them to the milestones that they want to get to is awesome.
Yeah, it's super cool.
Yeah.
What are some of the, I know there's so many clinical trials, like so many different, but what are some things that kind of fascinate you as you've seen over the last couple of years, like this is actually really neat?
Just some of them that, I mean, for example, when I was going through my treatment, so there was a clinical trial when I was going through, and so I did 3 drugs. It was the Cytoxan, Taxol, and Adriamycin, TAC. So those were given all 3 together for 6 treatments. The trial was to separate them and do TC and then Adriamycin. It's like to separate it because they were like, it's too hard on patients. We're going to try to see if it's the same success rate, switching them up or separating them. Well, now they do separate them. And so it was interesting that I was like, no. One of my best friends from college is an oncologist at Johns Hopkins. And she's like, you know what? Clinical trials are great. I love them. She goes, but we're going to worry about getting you to 30 more than we're going to worry about getting you to 60 right now.
Wow.
You know, and I was like, that's good perspective. Like, let's do what we know works.
Wow.
And then if it doesn't, then like, okay, then you can entertain some of these trials. And I do think that a lot of people
That's a good point.
do standard of care until the standard of care is not working.
Yeah.
And then they go to trials because if you're kind of running out of other options that are standard of care, you know, that's your best bet. And some of these clinical trials, there's been some Keytruda ones that Keytruda's everywhere now, you know, but I mean, it's, but, you know, several years ago, it was not one of the,
at all. Yeah.
and it was immunotherapy, but it was kind of like, okay, is this really going to work for people? And looking at different, you know, biospecific markers show that, hey, if you've got these, it might not work for everybody, but if you've got these,
then you're,
this is, you know, this is kind of your
more
golden
higher
ticket.
probability.
Yeah. And just the way that testing now to look at your specific tumor's genetic makeup,
it's amazing,
and what targeted therapy can be for that. I mean, it's pretty incredible that, you know, you have this one mutation, and here's like, okay, here's, if you have this mutation, here are the drugs that
can fight
it. And so don't waste your time, even if these other ones for your big picture diagnosis might be the standard of care. If you don't have this mutation, it's not going to really do anything. But these will, you know, so it's nice.
Technology is so cool.
So.
Wow. Question.
Yeah.
So if someone doesn't know the difference between radiation and chemo, what are those two?
So radiation is actually using, you know, radiation beams, and so it's very targeted. That will affect the surrounding tissue. But you go and have a planning CT scan, and then they mark little tattoos, you know, it's just like a little black dot wherever they're going to radiate, so that they can make sure that when you're laying on the radiation table, you are in the exact same spot every time, because the plan that they do is targeted to that specific spot, that little tumor or whatever they're using. So most people don't feel bad on radiation. Like, you might have some skin irritation where, you know, over time, but there's not usually systemic issues with radiation. With chemo, it's systemic therapy. So it's going everywhere. It's touching every cell in your body. And that's why different chemos have different, you know, half-lives. And some of them you do every 3 weeks, because after, 7 to 10 days after treatment is where you have your lowest counts of, you know, white blood cell, most susceptible to infection, things like that. And so then the next several days, it's building it all back up to then do it again. But it's killing the good cells and the bad cells for the chemo. So you've got to, that's why you have to check labs very frequently to make sure that you're still good to go the next round. Whereas immunotherapy is just building up the good, you know. So the hope is that you can kill the bad enough and then maybe stay on immunotherapy. So some people do chemo for several rounds and then things are looking good, and you do immunotherapy monthly for a year or so, you know, just to keep the good.
Wow. Do they do immunotherapy and keep going, and then do they do radiation as well, or no?
Some people do. It just depends. And there's some cancers that really radiation's not going to be as big of a benefit as others. And,
gotcha. But
they can do radiation for pain management, which is lovely. You know, you have hip pain because it's a side effect of maybe some of the chemo you're doing, and if a scan shows that you're, you know, there's, you know, inflammation there, then they can do radiation to help with some of that. So, yeah.
I didn't know that. Yeah. That's pretty neat.
Yeah.
Wow.
This is backtracking a lot.
Yeah.
Let's go back. Rewind.
Is there a specific moment where you thought to yourself, I'm going to go back to nursing school? Like, what made you?
I'd thought about it for a while. And I just kept thinking the timing's not right. And then the year that I decided I was done with teaching, it was just, you know, I think when you get in your mind, you're like, I'm done with this and I'm ready to go somewhere else. that it was just kind of like, okay, like I'm done and I'm ready to switch gears, and no time like the present, you know, I'm not getting any younger, so let's do this. But, well, yeah, I mean, I definitely, when I put my mind to it, I'm like, we're doing this now, you know, but obviously I was going to finish the school year because I wasn't going to do that to my students, you know. Bye. Spring break, I'm not coming back. No. But yeah, I mean, I felt very convicted in what I was going to do, and I was, you know, but of course, have a great supportive husband that's like, okay, like, so you're not going to work while we're in school? I'm like, no, like, I'm focusing only on nursing school, you know. But my parents are great, and they would help pick the kids up if I was in class or doing clinicals or whatever, so.
That's so cool.
And you kind of touched on this, how you talked about like how you kind of focus on the good of the patients, like the outcomes. But like, what do you do specifically, having gone through it, to not kind of get in that mindset that like part of your life that wasn't so great when you're dealing with patients who are also going through that? Like, how do you like maintain?
Yeah, I mean, I think it's because I came through it on the other side, you know, so it's like, it can happen, and it will, you know, I mean, the majority of the people it's going to happen for, you know, and again, it's not going to happen overnight, and you're going to have to really reframe your way of thinking, and you're going to really have to focus on the good. And, you know, what is the saying? There's, you know, what is it? Focus something about the good in every day. There's something good in every day, or I don't know.
Yeah.
So, you know, I'm talking about.
I get what you're saying.
Yeah, something like that. But I mean, because you know, right? I mean, every day is going to have something good in it, and even if you are throwing up after your treatment, but maybe one of your friends that you haven't seen in 3 months decided to stop by and, you know, have tea. I mean, like, you know, just something that it's like, okay, that was a good 30 minutes, right? The rest of the day might have been awful, but there was something good.
The good parts. And
it also helps you to see how many people love and care about you. Because people kind of come out of the woodwork when you're diagnosed, and they're like, oh my gosh, you know, I haven't talked to you in 6 months, but what can I do, you know? And
it's amazing.
But I don't know.
People making food and bringing it by.
Right. I mean, anything, you know, and I'm like, not just a meal train, I'm like, make a sign-up genius for your family.
Yeah.
Like, write down every day, like, especially when you're diagnosed, before you start, what are the things you don't like doing every day that steal your joy?
Yeah.
Write those down.
Do it. Yeah.
And then have people sign up for those things.
That's so cool.
You know, like, again, I hate vacuum. You know, I don't want to vacuum. I don't want to do my laundry. But guess what? Your friends would love to come take your laundry basket, go to the laundry, and bring it back to you.
That's so cool.
Because it makes them feel like they're contributing to you, and you're, you know, like, you're healing. So. I know, it's like, I was like, I wish I could still do that, still milk that 6 years, because I hate laundry. You know?
It's like,
who wants to do my laundry? Yeah.
He's like, make a Groupon. It's like, hey, you guys mind doing this for me?
Yeah.
That's a really good point.
But yeah, I mean, the things that are taking your energy and taking your joy, like, for the several months that you're doing that,
is there something
outsource it.
Is there anything that you did that, like you look back and you're like, this really like impact, like someone did something for you and you were like, oh man, that was so great. Like, just curious, was there any like,
absolutely. So one of my best friends from college, our daughters are 2 weeks apart, and she actually had a brain tumor when our daughters were 8 months old, and she had it removed, and everything's been good. But so I, you know, sent just a text to like my college group of girls and told them, because I was like, I don't have the energy to call everybody individually and tell them. So I was like, I just kind of put it on a group text or a group email. It was probably an email back then, let's be honest. It was not a text. It was 60 years ago. So it was a group email. You know, just kind of told them the whole rundown of what was going on. And, you know, of course, everyone's like, what do you need? What do you need? You know, and it's like, at that time I was like, I don't know what I need. You know, I just wanted y'all to know, pray for me, pray for my family, but I don't know what I want. Well, like 4 hours later, she lives 3.5 hours away. I have this knock on my door, and I was like, I mean, she was like, I know exactly how you feel right now. Wow. You know, because she had been through it a year and a half before.
My word.
You know, and so she just came, like, literally she came, she's like, I just wanted to give you a hug. Oh. Yeah. And I was like, oh my gosh, you know. And so obviously she spent the night because it was the night. We were going to kick her out. Right. But yeah, I mean, just the fact that it was like, I didn't know that I needed that, but I did, you know, and it was just like, okay, like, you know who your people are when something like that happens. And especially, but again, it wasn't that the other friends didn't have the same love and whatever, but
Correct.
she'd been there.
It's different. Yeah.
You know, she'd been through a similar
It
situation.
hit differently.
And she knew that, like, in her heart, she's like, I just have to be there. So that meant a lot. Like, it was, yeah, it was a very grand gesture that was very meaningful. So.
And you didn't send her back home right away?
I did. I'll let her split it up.
Yeah. You want to use the restroom real quick? All right, go ahead.
I'll throw you a water bottle. Yeah.
Oh, that's beautiful.
But I do think that, you know, people are amazing, and people want to.
They do want to help.
They want to help you, and let them. And again, people that have been through the fire. Yeah. They nurture you in a different way.
True.
So.
Amen to that. That's so true. Yep. It's like a different bend. Right. It's a different tenderness. Mm-hmm. Wow. Yep.
Are there any
No, this is great.
Like common misconceptions that you hear a lot from patients that you have to address on?
I think everybody thinks they're going to lose their hair, and not all chemos make you lose your hair. That's one. I think
Why is
everybody
that?
thinks that.
Just curious.
Just the nature of
the
mechanism of action of the drug. But yeah, so I think everybody thinks they're going to lose their hair, and I think everybody thinks they're going to be sick as a dog, and most patients are not. You know, I never was sick. I mean, they have great pre-meds now, and they give you things if you happen to have breakthrough nausea. But I mean, most patients are like, when am I going to start to feel bad? And you're like, hopefully you never do.
Yeah.
Because of all the things that are available to patients now. But I do think everybody thinks they're going to lose their hair and everybody's going to be sick. So.
A lot of Gatorade?
Yeah. Just drink something.
Something.
I mean, maybe not alcohol. But.
Liquid IV.
People who like have it running in the family, like genetics, is there anything you caution about, like starting early?
So yes, definitely do your screenings. Depending on what kind of cancer might run in your family, you might need to start earlier, obviously. But one of our nurse practitioners, actually at our office, does genetic testing for patients. So they run a full panel, and she has an initial meeting where she kind of talks about what this information will do for us, and then she does the test, and you have a follow-up appointment to see if any of your cancer or anything is genetic, and if so, certain parts, then it's like, okay, we need to get your children tested or your siblings tested. So it just kind of helps you to get the big picture of how vigilant do I need to be about screenings and things like that. My own daughter, well, Mom, don't I need to start getting mammograms now? And I said, no. And she said, well, why? I was like, mine was not genetic. And so you have the same chance of getting it, as I did or as anybody else did. But again, do self-breast exams, know your body. Yeah. And if something doesn't feel right, don't ignore it. Like, don't just think, oh, it's just whatever. Check it out. That's what you go to the doctor for. That's what they're there for. Like, anything that doesn't feel right, investigate it. And you'd rather go to the doctor for the same thing 3 times and them tell you it's nothing every time versus ignoring it and then finding out a year later that it's something bad.
Wow.
So
catch it early.
Yeah. So early detection is key. So just know your body, and if you don't have a genetic predisposition, it doesn't mean that you can't get it. Because most people think that breast cancer especially is, everybody who gets it's genetic, and it's such a small percentage of people that's actually genetic. So just stay on top of your doctor's appointments and your screenings that are age appropriate, and don't think that you're invincible, especially for the 18 to 26-year-old.
Oh, yeah.
Once you turn 30, you start to feel, then especially 40. Yeah. So at those points, you're going to the doctor a lot.
But, aches and pains.
Yes, but when you're young, you think, it's fine.
Invincible.
It's fine. So.
Wow. That's a good question. That's a really good question.
Last one.
Oh, this is good. Any other closing thoughts that you can think of as we kind of wrap it up? What are some thoughts you can think of?
Closing thoughts.
Advice.
Like I said, just trust your body, trust your intuition, give yourself grace. Let your friends and family help you. Let them love you the way that the best that they can. Don't expect them to do maybe what you would do. Yeah. Or what you saw somebody else do. Like, let them love you the way that they love you, and let them use their love languages to show you. So.
I like that you said something about the genie. What is it? The genie? No. The write a list of the things that you don't like.
Sign up genius.
Sign up genius.
Like a genie.
Oh, there. Get a genie.
What do I need help with? Let's see. Yeah. No.
Sign up Genius.
Sign up Genius.
That was really cool.
Like you just put all the tasks and your friend, you just send a link out when people ask and they can log in and sign up and then you have access to it too and see what people want to do.
That's cool.
If you get a text from me that just randomly says a sign up Genius,
right, you're gonna be like, hey,
I'm just like,
it's just because you and Emily want a date night and the grandparents are out of commission.
we just need help. I mean, like,
yeah, right.
Oh, well, thank you so much. This was fun. This was fun. Great job. But you did a really good job. You did a good job. Hope you enjoyed the video. Please remember to like and subscribe. We hope this was a blessing to you, your family, your loved ones, all your friends. Share it. And if you want to watch more videos, here they are. Enjoy, and we'll see you guys next time. Peace.